Okie dokie. All right.
Hey,
hi, Meg.
sorry. It's Meg. I'm here.
Perfect.
It was tough to get in.
Yes. We're running things a little bit differently this time because it's a longer event. So we've broken up all of the different sessions into, well, different webinar sessions rather than just one long one. So I apologize for the delay in getting in, both to you, Shelja, and Meg, and the audience for coming in. We were running a little bit late from the showcases and from the talk with Donato Cremuto, but I will also bring on our moderator, who actually this time round is going to be Kat Marriott, if I can find her in the audience. In the meantime, before Kat comes on, this panel is all about entrepreneurship and women's health and who is leading us into the future. Very, very appropriate for you, Meg, and you, Shelja. If you'd like to just take 60 seconds just to introduce yourselves and give us a little bit of a background on yourself. Shelja, we'll start with you.
Hello, everyone. My name is Shalja Dixit. Thank you so much for inviting me. I am a physician by training. I'm founder and CEO of a company called Curio Digital Therapeutics. We focus on women's mental health across their life cycle. I've spent about 18 plus years in medtech and pharma and also on policy side. So happy to be here. Thanks for inviting us.
Wonderful, wonderful. Thank you for coming on, Shelja. And Meg, over to you.
Hey, I'm Meg Columbia Walsh, and I am my video, by the way, Jared's saying host is blocking it.
Yeah, let me fix that for you right now, Meg.
Yeah, I am a director at AWS. Working in background is over 30 years in health tech as a founder of the first digital for other companies in an IPO. So I'm a distinguished fellow at Columbia, always supporting the HITLAB, great events, and thrilled to be here.
Thank you, Meg. It's always wonderful to have your support and your insights, of course, as well. And joining us now, Kat Marriott, filling in for Sarah Chochki, who unfortunately had an urgent matter to attend to. So Kat has kindly stepped in to moderate the three panels we have this hour for women's health tech, starting with Meg and Shelja, and then we're going to move on to Shamal, who was just presenting in the Innovator Showcase with Ziggy, and we'll have Organon and Vitala Health thereafter. So Kat, if you want to give us a background and take this panel away.
You're on mute, Kat.
Yeah, sorry, Kat, we can't hear you. No, so we still can't hear you, I'm afraid, Kat. I'm sorry. Let me just see if I change one of the settings here, if that works. Can you try now, Kat? Would you like to try signing out and signing back in? Okay. All right. Well, we'll get it right. We'll get it right at some point. I apologize, everybody, for the small technical difficulties we're experiencing right now. So what we'll do is that we'll move onto the discussion. Kat, when you have some sound, just jump in. But we'll start off with at least a discussion. I'm just going to bring up the points right here. So I guess an open question, both to you, Meg, and Shelja. Looking at to the new and emerging entrepreneurs in femtech and women's health, looking at the present state, could you give us kind of like an overview from your perspective as to how women's health and and entrepreneurs are kind of faring in this current climate?
Who would you like to start, Jerry? I'll start.
Well, you go right ahead, Meg. You came right in.
Hi, everybody. Sorry for the delay. As I see, we have almost 50 people on. Thrilled to be here. Women's health, boy, all of us on the phone are going, what a time in our country to be discussing women's health, and technology being just one major part of that. I mean, I think in the very positive, there are a lot of women entrepreneurs now. Fantastic. We have had a shift over the last 5 to 10 years of the venture community and the funding community really looking to fund women, looking to fund underserved communities, and seeing the importance of the emerging focused only technology on women's health. All really positive. Our industry in general has really promoted women, and we have life science community that is largely run by women, all really positive. And so the possibility to found companies, much different environment. It is possible. I think we have to be a little more careful now with the same rigor of what is the miss in women's health, what is our startup looking to solve, what problems are we looking to solve, and in the marketplace, what is the true market potential? Because you cannot build a startup unless you have a startup that can sail to an exit, and that scaling is pretty critical. But I think the foundation for today, we certainly cannot ignore the climate that we are in. And why do I say that? Because the need for privacy among the startup CEOs that are listening, or any what's called femtech, which I don't love that term, but any of the women's health initiatives or women's health companies that are involved, I think we just got a very serious warning that our privacy, our cybersecurity, our encryption, our password protection might be more powerful and more urgent than ever before. If currently I was a femtech CEO, the first thing I would do would be to stop literally everything in conjunction with my clients, my developers, my board, and talk about what privacy requirements would now be necessary. Women who would be interacting with and using any femtech technology for the purposes of managing their health, because the laws around the country are varied but serious. This is not a subject to take lightly as a founder, as an investor. If you have a true femtech company, that is absolutely a board level discussion that needs to happen today, because HIPAA is not going to protect the privacy of women using your technology. And you would have to do an audit of the state by state of which you operate in, if you do operate across state lines, which most of us do on the net. And you would have to have somebody and your legal aware of that to show that you did the due diligence necessary to protect the women who would now be using your technology to manage their health. So that changed within the last week. I probably would have said something much different prior to this, but it's certainly a very interesting and important discussion, I think, Jerry, for today.
No, I think you're 100% right, Meg. I think that, what's going on right now has certainly turned a massive spotlight, onto the way that, women's health tech is viewed from, not just, obviously the Roe v. Wade stuff, but as a whole. So, I think this is a perfect time to be talking about it for sure. Shelja, I'd love to go to you to see what your perspectives are.
Thank you, and thanks, Meg, for sharing that. I'll just build on what Meg said. Like, really, the good thing is, it's also a sad thing that after many years, finally we are focusing on women's health, right? I also don't like term femtech, but let's be with this, it's women do constitute the majority of the population. And finally, we have started looking at women health issue and designing solutions for that, right? Technology as being a very key component. But with that focus, and thankfully, investors, it is, getting attention of investors. It's still not enough, but at least there is a positive trend. Also interesting thing is some of the women-led companies, women issue companies or women's health companies, they have found some good exit. And that's definitely a responsibility of every founder, and we need to keep that trend, or else you see a momentum coming, it dies very quickly as well if you're not able to give the positive results. I do want to, I love what Meg said, with spotlight comes responsibility, right? So here is a time for every women's health founder today or women's health tech founder today to make sure that what we are delivering not just addresses an unmet need, but we take care of all of the aspects. Security is a really big thing. I just want to emphasize that our platform, we look at it as software as a medical device. This is a serious thing. It's not just HIPAA is just one aspect, very first aspect. There are multi-layered cybersecurity, testing, validation, a lot of other aspects. Quality management system need to be audit ready, database, what you're doing with that data, how that is being used, and so on. So I would just say that, I think the trend is very positive. We will most likely keep on seeing this trend because we are seeing some positive exits as well. So there is unfortunately, we are in an environment where women's health is becoming a very, very important issue. And this panel is extremely timely. We need to develop more solutions, but let's make sure that we take on this whole spotlight as a responsibility and keep the momentum and the trend going. That's what my message would be. Thank you.
Yeah, I love that. And I'm going to, I was thinking this morning, getting ready for this, one thing you just said, and I'm so glad you said it, which was registering yourself as a medical device. In the early days of developing health on the web, of course, everybody was very, very paranoid that we would be giving access to people's data and or health information. And many of the early mobile apps actually had to go to the FDA and submit their content to be considered for a med device. And I was thinking of that this morning and the privacy issues that are about to come. It is not an overreaction. I want the audience to hear me saying that clearly. As a board member, an investor, or an executive in a company that is solely targeting women's health, it is not, can you guys see me? Because my screen just died here.
We can see just fine, Meg.
You can?
Yep.
I don't know. I have no idea what happened here. I'm going to be typing while talking. So, the government this second is also focused on women's health. And the FDA, I think, would be receptive, and this is what I was thinking of this morning, because of what just happened and the reaction to it, to consider an emergency level meetings on which of the femtech technologies, especially for well-funded startups, could get accelerated consideration for being considered a mobile med device. And why do I say that? Because it allows encryption and it allows authentication that is more sophisticated than just logging in and or registering for an app. It gives the company and the investors an added level of protection. Now, it takes time, but considering the state-by-state laws, my gut instinct would tell me as a CEO that I would start that process anyway. After I did my audit, as I released my content, I would also be asking for a meeting with the FDA to discuss it, as there is not an attorney in the country that is not aware of the risk to women as they begin to look at what data they have out online already and what health information they then go to seek moving forward, as these laws right now are sadly accelerating across the country. And so that FDA designation you spoke of, one, very smart, and secondly, very important. And I think we have right now such an awareness of this issue that I would think those discussions could actually happen maybe quicker than they would have in the past.
Absolutely, Meg, and that's what we are seeing. We are in constant discussion with FDA. We have one product already, that has been through, and then second one we are talking, but FDA has been, this is a new trend, but I definitely urge. It took us a while. It's not easy. You need to have a lot of steps done. It's expensive as well, but why not? If we have to get something so important and crucial, we need to go through that. We felt that we have a sense of responsibility towards every, I won't call them patient, but user, every woman who's going to be on our platform. So I fully agree with that. It's not an easy pathway, but nevertheless, it's important.
That's right. And, look, there's a lot of not easy pathways to success in a startup.
Absolutely.
But one of the most important things in a startup is operational rigor. When I, after founding and exiting many, it became a pretty rote way in which I would develop them to scale, with scale being the key word. And one is the operational rigor of looking at what are the leaders you're going to need in the company, by what department, what are the processes that each one of those departments, what are the job descriptions, what are the base financials, what is the sales force that needs to be installed, acting as if you're a 2-year-old company within the first 90 days to 6 months. Absolutely critical. Because by the time we get to scale, we're ready. We have built and spent money up front that is so critical to long-term scale. This is one of those. So when I think about how I build that startup, when I think about that operational rigor necessary, when I think of the amount of work my key leadership team does before we're market facing, down to how we're going to manage the clients, what kind of reports we're going to give, like that type of rigor. This to me would fall in that. That's why I said in the beginning, I would immediately stop everything and have these conversations, because again, all of a sudden I start doing well. I don't want this new regulation or these new state laws to be in my way of scale. I don't want to have to be doing extremely well and say, gosh, we should have stopped back then because now we just hit the wall in this state. We just hit the wall in this state. We don't want that to happen. And so, again, for those listening, to me, this is just part of an unfortunate new part of typical board level things that come up for a CEO or a startup that require great audit, stopping, and investigation to pause for a minute to benefit yourself in the long run. Sometimes very painful, those pauses, but the pauses are critical. You do not pivot. I hate that word. There's no such thing. You evolve what you're doing if you're strategically sound to react to what's happening in the marketplace on any given week. And this is something that happened in any given week that we would need to react to, right? And so then we look at that, we pause, we see how we have to adjust our operations, make the board and investors aware, put together a solid strategic plan of how we're going to handle it state by state, and then we're good, right? Then we're back to creating content. We now have a plan and we can roll it out, correct?
Totally. Yeah. I would just say, Jerry, I don't know how we are doing on time, and sorry, Kate, but if you have any questions, we can take your time. But one quick thing I would say is that I invite any of the Women's Health CEO, if I can be of any help. We have spent first 2.5 years, literally on our first month of incorporation, talking to FDA and getting guidance and having a proper quality management system. So I will be happy to, if I can be of any resource to any other female founder here on, I would love to, volunteer that and talk to them. Our platform today is ready as software as a medical device with all the rigor. It was not easy as a startup, when we were in early journey to go through that, as Meg said. But the good thing is once you're done, then you are so confident about where we go and how you integrate that. Also, it helps us another way is to make sure that we are not creating just a shadow healthcare system. What I mean by that is you are integrated in the current ecosystem, right? There have been apps, if I can say that, out there, but to make sure that something is well accepted by providers, well accepted by a patient, well accepted by a payer, you have to make sure that the product that you're making works in the ecosystem. And for that, you need to have those steps. You can't even integrate with any EMR and workflow if you have not taken care of the aspects that Meg was just mentioning. So I invite you all to think about that how to make applications that integrate and enhance the ecosystem rather than just creating a standalone. So that's another advice or point I would like to raise.
Perfect. No, thank you,
Yeah,
Charlotte.
and go ahead, Jerry. Sorry.
No, not at all, Meg. I was just I was just thinking that you guys are having such a rich discussion here. I just want to just quickly check to see if Kat, you can come back on. Keep trying to say something, Kat.
I think she
said
she couldn't, Jerry.
Yeah. Okay. No worries. Well, I was thinking we have Shamal and Ziggy here as well, who are part of the next panel. But I think maybe what we can do is we can blend the panels together and maybe talk a little bit more, because you mentioned about provider resources and stuff, Shelja. Maybe we can get some perspective on it. Maybe again, very appropriately, because we're kind of bouncing off the whole Roe versus Wade thing. Shamal and Ziggy were going to be talking about resources in terms of provider and patient interaction and stuff. So maybe we could kind of take the conversation that way and bring these guys in to converse with you.
Well, I would love to talk a little bit about this beautiful, new ruling. Coming from Israel, grew up and raised in Israel, where women are, put on a pedestal and women's health is paramount. Coming to the United States 32 years ago, I was a little shocked to see what's going on in here now. Baby Life Advice has been caring for about 42,000 women a year now. Most of them are in very low socioeconomic status. Remote communities and rural communities, and those are the women who are going to be affected the most by this ruling. On Friday, when the ruling came through the weekend, our phones lines, our telehealth systems were literally falling apart. We immediately, Meg, and thank you for making that, talk about, security, had immediately find a way to secure our phone lines as well as our internet connection in the highest encryption possible, because we did not want those moms who are calling us, and those women who are calling us, to be prosecuted. But the stories that came from all over the country was really, really sad. Women who had appointments had them canceled. Women who were supposed to already walk into a clinic that day were denied. They would not be able from one moment to the next to get on a plane and go to a different state. That is not the easiest things to do these days, especially again for those women who are in a low socioeconomic status. This is really a decision that hurts women in a very profound way, especially because if you look at the map of the states who are denying abortion, you may have to go quite far in order to even receive a good consultation about it. These days, we are worried about how are we going to consult these women? What can we tell them that will not put us in the hot water as providers, as nurse practitioners and others? So I thought that the social anguish of this is far much reaching than that one decision that has been made. And I can tell you that we're still feeling it this week, where I tell you I'm not even wearing makeup anymore, because I'm hearing stories and I cry all day long. And my nurses are in anguish, and we really are trying to provide the best services, the best advice to those moms. But it comes down to women issue in the hardest of way. This is all happening quickly to say, while we have no formulas, we have no tampons or sanitary product for our women. This is not just one thing, right? There are no services for women who have COVID and now are pregnant. There are no good maternal services for women, no access for pre or postnatal care. This is not just about abortion. So once a baby is born, a mom is on her own. And so there is so much more to this than this one decision. And I am, of course, will do all that I can, and our company will do all that it can to support those women the best we can.
You know, Ziggy, you're saying something that, can you guys hear me okay?
We can hear you just fine, Meg, yeah.
Can you hear me? Okay. You're saying something that's very important, and I was just going to add at the end, which I think our coalitions and our partnerships, again, if I was sitting at a board or CEO level right now, are maybe more important than they've ever been before. Whereas a startup or a company might partner with a nonprofit or might partner with a provider or a payer or a life science company in the past for their business, for the mission of their business, or potentially a client, right this second, it is almost a public health emergency for that coalition to start in a much bigger way. And for even our startups to reach out to people that they might not have reached out to partner with at this time, because of some of the aspects beyond just this decision that you just touched on in women's health. We should not be there. We should not have such a disparity in service. The service is there. Even the surprise in hearing about breast feeding, and the lack of resources around it that women were speaking about during the formula shortage was so surprising to me, both as a woman and as a mom. And, you know, I just feel like those coalitions are something we should all be really rushing to the forefront of making happen right now. This panel is one. It was unavoidable to discuss this today. And this is just one. And very institution helping us to have this discussion critical than ever before, and to share with each other, to share as maybe in a way that we have not before, because I think the crisis is going to be real, Ziggy, as you described.
Actually, these are great points, and I would like to add a couple more things. And I agree 100% with all of my panelists here. You have mentioned really, really important aspects. And I would like to highlight a couple of things. I'm Shmal, I'm the CEO of an early stage health company operating in perinatal mental health area. So this is an extremely important topic for us as well. And, you know, one thing that Shaila mentioned, that, you know, spotlight comes responsibility, and this is like super well spot on. It is really important for us to look at a variety of things. And, you know, some of these things Meg already mentioned. One is, I know, you know, for example, in terms of confidentiality and data that we collect, we have to really scrutinize, like, do we really need every piece of information that we want to collect? Now, I'm a scientist, so I love, you know, data. But, you know, with these new rulings and changes, we really have to think, you know, and really, really make considerable decisions about what type of data do we really need to keep in our records. That's one of the things that I wanted to emphasize. Second thing is, you know, we are in a way that we have to really lead the path, and not just in digital health, but in general for all health providers that are helping to our, you know, client populations. What I mean is, since this decision, for example, came forward, many of the mental health therapists that are, you know, operating in their private practices are scrambling their heads, like how can they provide, therapy, what type of therapy notes now they can take, and whether they would be, put liable. So we really have a responsibility to not only pave the path for ourselves and digital health, and in general, everyone in the ecosystem, which some of you already mentioned. And the third point that I also want to emphasize, and Ziggy mentioned this, and this is really, really important. Many of us, develop our solutions for employers and also for people who can afford our solutions. And there are valid reasons for that. As an early startup, it's the other path is super resistant, it's hard to go, so on and so forth. But it's really important to keep in mind that 40 to 50% of people that we try to serve cannot afford our solutions. They are not privileged, and yes, they will be the ones most deeply affected from these rulings. So we really need to think about how we can open our opportunities to everyone. And finally, one more thing that I also have to add, because we are in mental health, this decision is going to affect the lives of many women. Not only women who will have to now make this decision, but also many women who made this decision long ago, because now we're also telling them that, hey, by the way, that decision you made, it was a criminal act. So we really have like much more responsibility now that, we had like 2 weeks ago. So I wanted to emphasize this couple points as well. And it's a great pleasure to be in this panel.
Can I would just like to say one further point that Simul made, which is very relevant. 50% or more actually deliveries in the United States happen in underserved population or economically not so privileged population, if I may say, right? So it's really essential. We can't address health equity and other issues that we talk about if we don't have solutions, we don't have investors who believe in those causes. So yes, as a startup, it is tough, when you are, because those population or, sectors of our society may not be able to afford, but frankly speaking, where technology can play the biggest and the most beautiful role is for those places which don't have access to, right? Because other areas and sectors and population, they do have access to some degree, right? It's not idle, but they still have something. My urge is that today there are funding opportunities. There are investors who focus and who have made this as a mission. For example, to have companies funded who look at uninsured Medicaid population and so on. So seek those investors. We were very fortunate to find investors who are not asking us that, just tell us like what numbers look like. It's more than a mission as well. And it would be a miss on many of our parts if you're not addressing 55% or so of the population or deliveries in United States, for example. So
68 of all percent of all deliveries are Medicaid funded in the United States. So yeah, so it's not a little bit. 68%.
It might have changed, Meg. You're absolutely right. Because of all of the pandemic, I think we had more, so thanks for noticing that. We always talk about it's more than 55%, but numbers are increasing, and it's nothing that any one of us should be proud of. US still has one of the higher and trending upwards maternal mortality in the developing countries. We are the only one which have upward trend, right? So something needs to be done for sure, and I think the technology companies and women health company need to focus and take that into account. So
I agree 100%.
I'm going to say something just for we're on a panel. And so this is an interesting discussion since we're founders here, right? But my aunt, Gracie, was a nurse on the Hope ship. And it was a ship that used to go around providing healthcare, huge medical ship. And I was thinking this morning, as I was thinking of all these pressing issues and recently seeing the formula crisis and everything you're saying and the shocking number that they are off, that if you think about food trucks, I was thinking this morning as an entrepreneur, in just big thinking, like, man, if I had enough money, I'd take one of those world hugest cruise ships and call it because the laws on the water are different, to be able to provide healthcare services, education, etc., and then a fleet of matching marketed logo trucks that traveled to some of these underserved communities. And as I left the bathroom getting ready, I thought, that's actually not far-fetched.
Not at all.
That's the coalition that I'm talking about. It is the coalition and the thinking that's going to be necessary to get us through what we all are talking here. That is a crisis prior to Roe being overturned, as you're pointing out, Ziggy. A very big crisis from the richest nation in the world that should not exist. And it's going to be the women, us, on this phone, those interested in this subject, all of you young women following in my footsteps now. It is going to be us that can and will do it. So the hope is you can do whatever, we can do whatever, it can be accomplished, it can be put together, we can find people to fund it. And that is the positive note of an innovation call like this, is that it is totally possible. And even that crazy idea that I just gave is not actually so crazy when we look at how we're going to navigate these state laws, even if we had to do it over the water. And so, there is hope in the conversation, as daunting and as tear-filled as it is, because women entrepreneurs are powerful and can accomplish an amazing amount. I just think we're going to have to work together much more than we're used to, both from the funding, the institutional, and the corporate, the nonprofits, etc. I think this is a moment of a summit I'd love to call because we really need this for the women's health crisis.
Totally agree, Meg. I think, I think you really hit the nail on the head, with all the different points you make, kind of bring everything together. I want to kind of go to that point of, you talking a little bit, about those underserved populations and stuff, since we have both Rupan and Sarah Harris from Organon, who've just joined the panel here, who I think, really deal with a lot, of that serving of those underserved populations. So Rupan, you were here first, so we'll go over to you to kind of chime in, and then we'll go over to you right after Sarah.
Thank you so much. I have put in the chat that everyone saw because I've been dying to say something. So I'm Rupan. I'm actually an obstetrician gynecologist based here in Toronto, but I'm a co-founder of HITLAB Global. And actually, I am an abortion provider myself. I've been committed to this work for the last 5 years. I did my training I was the only Canadian fellow and was trained with all the American fellows through the Society of Family Planning. And this is like my life's work. I am super passionate about this. So when we heard the ruling go down, the last couple of years particularly, I co-founded HITLAB Global, and we are a femtech company, and we are committed and dedicated to co-designing digital platforms for women and girls so that live in challenging contexts to self-manage their own abortions. And it's very interesting because as someone who's worked in very challenging contexts with Médecins Sans Frontières, Doctors Without Borders, in countries like Yemen, Northern Nigeria, Lebanon, now with Venezuela, we've seen what it means when you have when it's restrictive laws and lack of access to comprehensive abortion care. I've also worked with the WHO with their Safe Abortion team as well. So I am, very, very passionate about this. And I Contigo is our digital solution that we co-created with Venezuelan women. And that's how we do our work. We really work with the women, the girls, people with uteruses, and the local grassroots organizations who have been fighting at the front lines along this work. And that's what I would really want to highlight, is that there's a lot of groups in the US that are reproductive justice groups that are working at the front lines, that have been doing this work over the last decades, pre what has happened with the falling of Roe v. Wade. And if we really want to make impact, we need to empower those folks. And that's what's really helped us. So we launched I Contigo, which is basically a virtual accompanier that helps women to self-manage their own abortions. And we facilitate the process through a harm reduction model. So we provide the information from them being able to self-assess eligibility, that they can actually do the medical abortion with pills, all the way to self-assessing that they've successfully completed it. We have a virtual chat team that is always available to support women, because the app and digital solutions are not the panacea, especially around abortion care. We also do work in miscarriage management. People need someone to talk to, and we have local Venezuelan staff who are there to support women. And then we also have a personalized contraceptive aspect to our tool. So we launched in March 2022, and we've had over 800 Venezuelans that were on our platform, and over half of them have engaged with our virtual chat support team. We've raised already, and we're a not-for-profit organization, so I was hearing a little bit of that need for not-for-profits and for-profits to partner, and I completely agree, because funding and investment in abortion care is very tough. And we are really lucky because we've had funders like Grand Challenges Canada to support our work. And then I've had a group of these amazing female philanthropists that have also given us some catalytic funding. We kind of call them Stardust angels. Like, you know, they're angel investors, but we really say they're like our angels, because they really, really supported us in so much of what we've been able to accomplish. And now we're being called to rise up. Like, folks have been reaching out to us to know the work that we've done in Venezuela with Latinas. And as we know, in the US, there is a huge population of Latinas, and there is a lack of Spanish resources for women. Even the telehealth services that are out there do not have language services. So we have something that's available, and we're looking at ways that we can bring it to the US and to Mexico. So yeah, I'm very passionate about this topic, and I just feel like it's crazy, you know, exactly what Meg was saying, that this is one of the richest countries. Like, it's like, what kind of example is this showing to the world? And for me, being in places that are like Yemen, for example, and that I was stuck there during the pandemic, to the 6-week mission ended up being a 6-month mission for me. Yeah, and I also want to highlight quickly, and then I'm going to stop, is that abortion, I feel like folks like talk about abortion and it's like this umbrella thing, but there's so many reasons a person has an abortion. The reason is not as relevant, but now in these conversations, I feel we need to showcase that, because I take care of women who need abortions for, you know, fetal anomalies. I take care of women who are sick and they need, the pregnancy needs to come out so that they can survive, we can save their life. We do abortions for folks that want to go to school and finish school because the pregnancy is just not going to work for them, or, you know, economic reasons. There's so many reasons. And we also know that it's a complex process that every person goes through. They need the support, they need a lot of things. So it feels like, yeah, really this moment we're all being called upon to really do something together as a collective. And anyone who's here listening who invests in femtech and has money, like, this is where we need to put some money and really, you know, get the show on the road.
Thanks, Rupan. No, some really, again, really powerful statements and really powerful points to put across. And I know, Sarah, you've been waiting there for a bit of time to chime in. So we're going to go over to you to kind of build on that.
No, thank you. It's been really incredible listening to all of the contributions and the points of view. I might just start with just introducing myself. Might have a slightly different angle. So my name is Sarah Harris, and I lead policy and government relations for the Middle East, North Africa and Turkey cluster as part of Organon. And for those that haven't heard of Organon, we're a women's health company that essentially spun out of Merck in June of last year. So we've recently just celebrated our first birthday, and we're a global healthcare company focused on women with the vision of creating a better and healthier every day for every woman, focused on addressing the significant unmet needs around women's health. And for me, prior to Organon, I was working with government, so with the Australian government for a number of years, focusing on healthcare and also specifically digital health. So that's really where my passion lies here, and where I believe we can, you know, improve systems, create efficiencies, improve healthcare outcomes by leveraging new sort of digital health innovations and tools.
I'm sorry. Well, the wonderful breakdown there, Sarah. Did you want to add to anything that Rupan or Meg has kind of said on on topic so far, or did you want to kind of maybe go into a bit more questioning about what the I suppose what the unmet needs are right now in terms of the regions that you kind of wanted to reference and stuff as part of the prep to the call today?
Yeah, did you want me to talk about the unmet health needs for women? Is that the question that you wanted me to address? Or?
Yeah.
Yeah, okay. So I'll just mention a bit about what we've done. So as a company, we launched as a listening company. So really wanting to listen to women and understand where their unmet needs are, where their greatest needs are. And to do that, we had a number of listening exercises. So one of which is called the Here for Her Health platform, so hereforherhealth.com, where women were able to provide their inputs and insights around what the greatest unmet needs are, where there should be a greater level of focus. And the key themes that came out warranting increased attention there were self-care, women's mental health, respectful maternity care, as well as non-communicable diseases and others. So that's probably some of the themes that we've seen. And this is a global exercise, so it wasn't just for the region, but it does apply as well. So there's some of those areas.
Okay, perfect. Thank you, Sarah. Yeah, I mean, look, thanks for giving us a bit more of a breakdown in terms of what you're seeing from your perspective. I know that Ziggy, we didn't really get much from you. I know you kind of came on in the middle of the previous panel, and I see you kind of been holding back.
Oh yeah,
putting in your own opinion. So we'll go over to you.
Well, I think that it's great that there are so much. We're talking a lot about abortion care. Unfortunately, our government is obsessed with protecting the fetus up to 9 months of age, which is wonderful. I don't know, why we do that. Is when a mom gets pregnant in the United States, the likelihood of dying from that pregnancy is actually 14% higher than if she had an abortion. So I'm going to say that again, people need to understand this. A mom has a 14% higher chance dying postpartumly in the United States than she is from getting an abortion, okay? So that is how bad things are. 68% of our moms in the United States are under Medicaid. When there's no access to care, it doesn't matter where they are in urban or in a rural community. They cannot reach or get OBGYN care throughout the pregnancy, sometimes going throughout the entire pregnancy without even seeing a physician, showing up in a local emergency room, having their babies. Black women, of course, 30% higher chance of dying, having their own babies that their own grandparents had when they were working, here as immigrants years ago. And our infant mortality rate before the age of 1 year is the highest in the industrial world. So to give in numbers, 5 women die here every day from pregnancy-related complication. Up to 10 babies, especially in the Black Hispanic communities, are dying here every day, not from abortions, but for being born in the wrong place at the wrong time. And those moms will go through pregnancy unsupported. They will be leaving the hospital after 24 to 48 hours, even if they're bleeding, even if they cannot breastfeed their babies. Now there's no formula, so they can feed their babies. And they'll be pretty much thrown out of the hospital without good discharge plan, without any plan of how they're going to be accessing care later after they have their babies. So Roe and Wade has a lot to do with, the hypocrisy of the whole thing. We want to protect pregnancy in all costs, but we're not willing to do anything to support the women once they get pregnant. We don't do anything to support them when they are pregnant, postpartumly, or up to a year of the baby's age, when we're seeing so much mortality rate. So the hypocrisy here is, what are we obsessing about saving this pregnancy so badly if we are not willing to do anything to support women once they have those babies? No maternity leave, no sick leave, no family leave, no support for breastfeeding, no formulas, no tampons or pads. After you had your baby, you're bleeding for at least 6 weeks. There is no pads on the market. You can find that. So What are we so obsessed about here, protecting the fetus? Why are we not protecting the live babies that are being born? Why are we not protecting the moms who are giving birth to them? And I do want to speak to Meg's point. Coalitions is the only way to support this. Baby Lab Advisors has been working very hard with Johnson & Johnson, with the March of Dimes, with the National Black Doulas Association, with the National Birth Equity Association and others. We are making a lot of, coming together, especially now, especially more than ever. If we are not in partnership and we are siloing this system further, we are breaking a system that is already broken. We need to come together. Everybody who has a solution out there, Baby Lab Advice will work with you, will not ask you for a dime. We will be your friend. We will work together, and we will reach every mom and every baby in the United States, from all the way from the lower side of, of the city all the way up to the north. Because the reality is, unless we do it, no one else will do it for us. Nobody cares. I'm sorry to say it, but nobody cares. We are the only one who cared, and we need to do it. We need to come together and work hard to just support the women that are out there. And that's what we do. And by the way, to talk about Medicaid, Baby Lab Advice focus only on the almost solely on Medicaid for a reason. These are the statistics, right? The statistics don't exist in a high, white, low economic status. The employed women who are getting wonderful benefits through their employers are not the ones who are dying on the pregnancy bed, you guys. They are far and few between. Those who are the ones who are not have access to care, who cannot speak the language, who can't speak for themselves, who don't know how to self-advocate, are not educated, so they cannot reach a very complex application and knowledge base. They need to be told in their language by a nurse that looks like them what is going on. So we really are focusing on that population. And if anyone wants to talk to me about the how we have been able to care for those kind of people, Navajo Nation all the way down in New Mexico to Black Hispanic women in Georgia, please ask me and I'll tell you there is a way to reach them, and there is a way to actually be funded to do so. That's all I want to say. Please, let's think about what happens when we are pregnant already and who's taking care of us then. Unfortunately, not with too many people.
Yeah, thank you, Ziggy, for bringing us to that point, and really just looking at it again from that different angle and stuff. We are at the top of the hour, and we've been able to somehow merge all the 3 different panels into one mega panel here. I definitely would love the conversation to go on. It looks like everybody here has got way more to say, and I think there's a lot of rich discussion from the audience as well. What I'm going to do actually is I'm going to suggest that we all migrate over here. I'm going to share my screen. If you can all get to the lobby, I will open up the Women's Health Tech networking room here. And the first person that comes in, I will make the host so that the room stays open, and we can continue this discussion offline, off the at least the webinar. So everybody that does want to chime in will get we'll get a chance to join in the discussion. But thank you everybody for coming on. Really rich. It's probably the richest discussion I've been a part of at HITLAB in a while. So I want to thank you all for coming on. Thanks everybody for giving us such good interaction in the chat as well. And I'll see you all at the Women's Health Tech networking room in just a moment before I have to go on to the next panel. So thank you everybody, and we'll continue the conversation in one of the networking rooms.
I hope I can find that. Thank you, Jerry.
Okay.
Terrific discussion.
Thanks, everyone.
Thank you.
Everyone. It was a real pleasure.